Lorgase Leon Herrero, Governor of Guam, Nagahagan Guahan, Linda and Pinko Denorsi, Director of Public Health and Social Services, and Dr. Felix Cabrera with the Physicians Advisory Group.
Thank you. Hafaday. Throughout the course of our response to this epidemic, it has been my duty to announce when we have lost someone in the fight against COVID-19. And while privacy laws prevent me from disclosing their name, I can tell you that each of the people we lost is missed by someone they left behind. Of all the choices a governor can make, none are more serious than the decisions we make in response to a life and death emergency. Today, the legislature ended debate on the matters before it. Much of the debate centered around the powers I should have in this emergency. At various points throughout this emergency, senators have asked me publicly and privately to execute curfew and clearly enforce the mandates of my executive order. These same senators argued that these expanded powers were necessary to save us from uncertain times. Now, some of the same senators say these ideas are excessive and overreach and wrong. While this is the equivalent of being tossed the lifeline only to watch bystanders toss away the rope, I respect their decision. I only hope we won't be back here in a few weeks asking for the power to fight a surge of new cases. Regardless of what the legislature does or does not do, no matter how they help or withhold help, my job is to keep Guam safe with every tool at my disposal. Nothing will deter me from that mission. We all realize that we have never experienced a crisis quite like this before. I know that each of you has fears, maybe experiencing loneliness and worrying about the safety of your loved ones or even the potential of loss. But we must remember that in times of difficulty and stress, we need to stand with each other through our struggles and our successes. I know that many of you have asked what the way forward looks like. Today, I would like to announce that we have increased our testing capabilities. Guam Memorial Hospital now has the ability to test COVID-19 infection with their newly acquired machine. This machine will have results ready in at least 15 minutes. And after validation, Public Health and GNH will have the capacity to test 150 additional samples this week. That number will rise to 200 weekly. But increasing our testing capacity with the goal of testing everyone in Guam is just one of the conditions we must meet to fully lift restrictions. We need to remember that this is a marathon, not a sprint. It can take one person spreading the virus for us to see another explosion in cases and creating new clusters. When this pandemic is over, it may seem as if the end did not justify the means, that our measures were a little extreme. It can be difficult to comprehend that staying at home really will save life. However, the results of these measures, the goal of social isolation directive, really is nothing. In order for this to be a success, it has to feel like nothing happened. Because nothing means your family, friends, neighbors, and colleagues did not get sick. Please don't give up. Don't feel complacent. Don't do anything that will reverse what we are seeing now. I'd like to ask Dr. Cabrera now to make a few comments. Dr. Cabrera?
Sure. Thank you, Governor. Hapaday. I'm here to read a letter that was from the State Surgeon, Colonel Michael Cruz, to the Speaker of the House. So the Speaker of the Senate. Yeah, sorry. So dated April 15, 2020, Honorable Tina Munya Barnes, Speaker, Iminajunta Singput, Nalita Sesum, Aguacan, Guam Congress Building, Saganya, Guam. Dear Madam Speaker, Governor Lou Leonguero's Physician Advisory Group is in receipt of your letter dated April 14th regarding the potential use of South Korean test kits for COVID-19 confirmation. While it is clear that mass testing is essential to combating this virus, that testing must be safe, accurate, and reliable. Unfortunately, as recently as yesterday afternoon, my conversations with the U.S. Food and Drug Administration indicate that specific test kits alluded to in your letter have not yet received FDA approval or an emergency use authorization. This is despite the fact that some international media have said the exact opposite. To be clear, this does not mean that your suggestion is without value. The kits referred to in your letter can be used to determine COVID-19 infections on a presumptive basis. This simply means that results, both positive and negative, will have to be confirmed by another testing meeting FDA and CDC standards. Given the national shortage of test kits, some U.S. jurisdictions may be willing to adopt protocols that deviate from the standard of care, but that is not the direction dictated by our present circumstances. Pending additional guidance from the FDA and CDC, we must understand that through more testing should be done, unreliable test results can become even more dangerous than no testing at all. Because even one COVID-19 positive patient can be an unwitting weapon against our entire community, I fully appreciate your desire to rapidly develop our testing capacity. This is why we work to obtain rapid ID test kits and equipment from Abbott Laboratories. Guam has received a commitment of 200 Abbott ID Now test kits a week, which can obtain results within minutes. Additionally, these kits have received emergency use authorization by the FDA. As a physician and former Lieutenant Governor of Guam, I understand the immense challenge faced by island leaders today. Please note that I and other physicians actively review testing and treatment innovations of COVID-19 throughout the world. If tests like the one that you have mentioned can return a credible result, one that is accepted by the FDA and CDC, I will have no problem recommending their use. Our advisory group also understands that both science and technology behind COVID-19 testing is rapidly developing. For this reason, we are preparing to outline protocols for the adoption of new tests. Until then, should you have any information demonstrating that this foreign test has been approved by the FDA and CDC, please feel free to share with me. Sinceramente, Dr. Michael Cruz.
Thank you, Dr. Cabrera. I'll ask Linda now to give us an update of our COVID cases.
Yes, thank you, Governor. As of yesterday's testing, we tested 32 samples, and of the 32 samples, 30 are negative and 2 are follow-ups. And so this brings our testing from March 12, 2020 to April 14, 2020, with a total test result of 831. And of that, 715 are negative and 116 are positive. And when we add all the information together, we currently have 135 COVID positive cases. 116 are local, 11 are from the U.S. Naval Hospital. These were tests that were performed by the Department of Defense Reference Lab in San Diego. Additionally, we have 5 cases confirmed by our DLS laboratory, and 3 are clinically diagnosed. And thus, this gives us a total of 135 cases on Guam. In terms of the demographic distribution, I'd like to go over that with the 135 COVID positive cases. From the northern region, we have 69 COVID patients. The southern region, we have 21, and the central, 43. We have 2 that are homeless, and thus that is 135 cases. In regards to the age group breakdown, as follows. For those age groups 0 to 9 years of age, we have 1, and that's a 1-year-old baby household contact. From the age group 10 to 19 years of age, we have 7. And of that 7, 5 are household contact, 1 is travel related to Honolulu, and 1 is from a birthday gathering at a hotel. Age ranges from 20 years of age to 29, we have 14 COVID positive patients. The age range from 30 to 39, we have 14 patients. 40 to 49 years of age, 24. 50 to 59 years of age, 25. 60 to 69 years of age, 34. 70 to 79 years of age, 11. 80 to 89 years of age, 4. And 90 years and above, we have 1. That gives us a total of 135. In regards to the gender, 72 are female and 63 are male. The medical status of all our COVID positive patients, 50 are stable, 7 are hospitalized. As of yesterday, we have 3 at the inpatient care at GMH, 2 at the ICU, and 2 at the skilled nursing facility. We're happy to report that we have now 7 more that have recovered, giving our total of recovered patients to 73. And of course, 5 have died, thus 135 individuals. In regards to the cases in isolation, we currently have 27 in home isolation, 23 in the isolation with the Government of Guam facility. As I mentioned earlier, 2 are at SNU, 3 are inpatient care at PMH, 2 are at the ICU, 73 have recovered, which is about 54% of our population. 5 has died, thus 135. In regards to the travel history, 18 individuals, 3 have traveled to multiple countries, with 65% traveling to the Philippines. 117, however, have no travel history at all. And those 117 are broken down as follows. 35 has household contacts, 13 community contacts, 19 healthcare contacts. And of that 19, we break it further down with 5 as a patient and 14 as healthcare workers. And 50 have no reported contacts. In regards to our quarantine sites, we currently have 237 individuals under our Government of Guam quarantine. In regards to travelers that have completed their 14-year quarantine, as of yesterday, we have 20, and today we're going to have another 16. Thus, we have 269 individuals altogether that have completed their 14 days of quarantine. And our isolation, we have 23 facilities in our Government of Guam. Of those, 73 that have fully recovered, representing 54% of our COVID population. For the age breakdown, it is as follows. 0 to 9 years of age, 0. 10 to 19 years of age, 4. 20 years to 29 years of age, 10. 30 to 39 years of age, 10. 40 to 49 years of age, 17. 50 to 59 years of age, 9. 60 to 69 years of age, 14. 70 to 79 years of age, 5. 80 to 89 years of age, 3. And 90 years and above, 1. In regards to the sex, 40 females. More females are recovering than the male at 33. In regards to the regional areas of those that have recovered, 24 are from the northern region of the island, 34 are from central, 15 are from south. The travel history of those that have recovered, 14 have travel history, 33 have no travel history, and 26 are yet to be determined. We're happy to report also that our DLS laboratory is also providing our testing also off island, and these are in Hawaii and the Quest, which is another commercial laboratory aligned with DLS. And from April 3rd through April 13th, we have 101 tests that were done through DLS, and of that 101, 96 are negative and 5 are positive. Thank you, Governor.
Thank you, Linda, for that report. We're open to questions now.
As a reminder, you get 1 question and 1 follow-up. We'll begin with the point, Nick Delgado.
Hi, hello, Governor. Hello, Linda. Hello, Dr. Cabrera. So, thank you so much for
Stand by, Nick.
hello.
Nick, can you check your audio, please?
Check. Hello. Can you hear me? Hello, test.
Can you turn up your volume, Nick? One second. Okay, Nick, can you? We'll come back to you, Nick. PNC Kevin Kerrigan.
Good day, Governor. I'd like to ask you about the 111 million in stimulus funding. We understand that the formal application was submitted yesterday by Edward Byrne at DOA. Can you tell us what the status of that application is and when you expect that money, and what specifically, what is the priority list for what will be that money will be used for?
Okay, so we did send in our certification letter, and we also registered online, and we got confirmation back that they received our registration. And so we should be expecting money to be downloaded to our account by the end of this week, if not sooner. Those monies, Kevin, came from the CARES Act, as you know, and there was $150 billion that was appropriated to 50 states, the territories, and tribal communities and government. And off the 150 billion, 3 billion was given to states and territories. And we got a share of 100 and I think they said now it's 117 million. And my understanding, my information is it's based on calculation of your population. So they have now advised us and told us that our share is 117 million. There are three basic uses for those, and they are for expenses of those that have not been budgeted in the fiscal year budget. They are expenses for, of course, COVID related and prevention measures that we're taking and so forth. And there's also for expenses, and it was the general expenses related to COVID measures and COVID events. They also made it very clear to us that it would be not, it cannot be used to recoup lost revenues as a result of COVID. And of course, as a result of the economy tanking and just business activities basically placed on hold. The states, the 50 states and our territories are lobbying very hard and are asking the president and the vice president to allow for lost revenue. There are going to be some more guidelines and some more advices. They informed us that will be coming out. So hopefully we can do that for lost revenue. Hopefully we can use it to replace lost revenue. But so now we cannot. It has to be for expenses incurred as a result of our COVID virus situation.
Your next
David.
question, Kevin.
Just following up on that, though, I would imagine that you and your advisors are developing a priority list for the use of that funding. What are you going to use it for? Can you tell us what those priorities are?
Well, priorities, of course, are for immediate supplies, equipment, assets that are necessary to continue on with our prevention, our treatment, our monitoring, our surveillance, you know, like for example, our facilities that we are using for quarantine and our facilities that we're using for isolation, our facilities that are being used to house our medical personnel so they don't go home and they stay within, away from family for preventing possible contamination. Those would be, it would also, I believe, for services delivered by individuals, contractors, vendors that are related to COVID.
Thank you, Governor.
Thank you, Kevin.
Okay, let's try going back to Nick with the point.
Hi, can you hear me now?
Yes. Thank you.
All right. Thank you so much. All right, Governor. And so you saw the news yesterday about the CNMI, some great news for them getting some 60,000 rapid test kits up there, 20,000 received so far. We understand that this was a same proposal given to the government here in Guam. And so question is, what did we not decide to proceed with that, with requesting those same tests that the CNMI so that we can get the large bulk that they received as well?
Right. So, Nick, I'm going to explain a little bit about healthcare and industry standards. In healthcare, it's a very sensitive, I think, service to deliver to our people because it can mean life or death. So there are standards placed, there are best practices placed, there are guidelines placed, there are validations placed. There's a lot of scrutiny and there's a lot of protection and there's a lot of regulations. So to assure the public that whatever procedures, whatever equipment, whatever treatment we provide for our very, very essential and crucial community, that they are based on standards and they are approved by entities who monitor and regulate those procedures and treatment and equipment. So these tests that are coming in have to go through that same scrutiny. And so as governor responsible for the safety of our island and the health of our island, I am very much determined that we have to abide by the rules, the regulations, the standards. These test kits are not FDA approved. They're not even EUA approved. And so I don't want to risk to our community the possibility of these tests being not effective, being not accurate, being not reliable. Because what that means is if this test gives you a negative and you're really a positive and the test says you're negative and you rely on this test, that gives you a sense of false security. That gives you a sense of false positive and false negative. So a false negative person may think, oh, I don't have COVID-19, but they really do. And as a result of that, they may think, oh, I don't have to wash my hands anymore. I don't have to isolate myself anymore. That's the risk and the consequences of allowing non-FDA approved kits to be used in a community.
Got it. Okay, so it sounds like a risk that the CNMI government is going to take. So thank you for that.
You know, that's his decision. I cannot. He and I spoke, and I told him what my feelings are. But he, you know, it's his decision, and I respect that. He weighed out his risk in his own community, and if that's the decision he wants to do, then that's what's going to happen. I particularly don't want to take that risk.
Thank you so much, Governor. All right, and so this next question is for Linda. Linda, so yesterday and today you explained how we're going to be getting more test kits, more of those on the way, some great news, of course. And my question is, where are we at in relaxing or amending the conditions, the requirements to test people for the virus? Are we coming close to expanding those guidelines so that more people can be tested? And what date will the public health lab be able to run more tests than 40 plus that we've been seeing daily?
Mm-hmm. Yeah, right now, as I mentioned previously, that we're doing priority. So in regards to expanding it, we are already expanding it. We're already doing it. We're doing it through DLS. We're doing it through the off-island Hawaii and also with California through Quest. So as I mentioned earlier, we did about 101 already. So we're going to continue to do that. And yes, we are expanding in terms of as soon as we get more and more kits available, we're going to continue to do any patient that is affiliated. If we find out during the contact investigation and follow-up that there are other members that are affiliated with an index case. In other words, they could be household contacts, or they could be also community contacts. We are going to definitely test these individuals, especially if they are symptomatic. So the answer to your question, we will expand it, and eventually when we get enough test kits, we also would like to see the incidence and prevalence rate of this infection on Guam. We also, as the governor mentioned earlier, we have 2 Avid ID Now machines. And also along with that, we were assured by US CDC that we are going to continue to get a flux of test kits coming in. And as we speak, my staff have already ordered the next cartridges that will come in. And again, it's a point of care type of rapid test, very much approved by FDA. And in fact, when the governor was talking, I do have the whole listing of all the machines that are approved by FDA right here. And I'll be happy to share with anybody that would like it. And that came directly from the federal government through our contacts with the federal government. Realize that we are up to par with CDC standards. And for that reason, we want to ensure the safety. And we were also notified that there are counterfeit test kits that are being circulated. And that memo came to me. So we're very, very cautious and very careful. And as the governor had alluded, we want to make sure that we really have the safety in place. And that is by far the most important thing. I also spoke with Esther Munia, my colleague, and she's from CNMI. And she also told me that that test that they received, they're not using it for diagnostic purposes. They're just using it for surveillance. And obviously, when we do testing, we want to ensure that we don't need to waste our test kits. We want to make sure they're accurate, they're reliable, and they're valid.
Thank you, Nick. Next is KOAM, Nestor Lecanto.
Good afternoon, Governor, Linda, Dr. Cabrera. First question is for the governor. So the Defense Secretary Mark Esper held a press briefing today in Washington, and he was saying that he was been talking to the various governors about DoD assistance. And then he mentioned specifically that he spoke with you earlier this morning. I was wondering if you can share what you discussed, and did you ask for DoD for more assistance?
Yes, so I did speak to Secretary Esper this morning. Very wonderful individual. And he called me for 2 things. One, he wanted to thank me and the people of Guam for helping them out with the USS Theodore Roosevelt, and wanted to let us know that our help and assistance is very well appreciated and very well noted, not just here in Guam, but also in Hawaii with Indo-PACOM, and especially in Washington, D.C., and especially at the Pentagon. And so he wanted to personally offer his thank you. And then the second reason he called is, as he said probably in the press conference, that he calls governors to find out how DoD can help. And we talked in length about what are some of our needs that they can help us with. Of course, medical bed capacity is one of them. Medical personnel is another of them. Medical supplies, medical equipment, and of course, test kits and so forth. And in relation to the medical component, there are 2 major hospital field tents that are being erected here in Guam to help the military deal with the USS Theodore Roosevelt sailors, should they come to the position also of having to admit more patients and take care of more critically ill individuals. Those 2 facilities are going to again stabilize the sailors. But after that, they're going to leave it and for our community support and for our help. they're not only going to leave the tents, but they're also going to leave the medical personnel in case we do need them. So he is going to confirm that offer to us. And then we talked a lot about PPEs and test kits, and he's also going to work his assistance in making that come to us in a much more expeditious way. We also talked a little bit about situation here in Guam and so forth. But for the most part, it was to offer his thank you and appreciation and gratefulness. He just said we cannot imagine what that meant to the whole Navy, to the whole Navy military forces. And so that's, I think, that's how we are as a community, Nestor. I told him that I didn't make the decision very lightly. I looked at first, my priority is, of course, protecting our own people, our residents, our community. The second was, do we have the capacity? And the third is, how am I sure that exposure is not going to increase with our community? And all those three were met to my satisfaction. And that's why I decided to allow the sailors to be housed in our hotel in the community.
Thank you, Governor. My second question, of course, the legislature met today very briefly, and I believe they're expected to vote tomorrow on various bills that are on third reading, and that includes Senator Shelton's curfew bill. The language of that states that the curfew, quote, should be in the least restrictive means necessary. If it is passed, and you, based on your comments earlier, hope it is passed, how would you implement that? What would be least restrictive?
I would follow the letter of the law, and I would, use my resources to implement it. And I would have more police officers out there patrolling the roadway. I would have more police officers patrolling various communities. I would also do, again, an educational campaign on the importance of staying home. These are the penalties if you are traveling after curfew. You will be stopped and you will be asked what your business is. We are already enforcing very heavily the minor curfew, which is the current law. And the police are using that tool to be able to go to the park. And when they see young minors there, they are told to go home. Or they are also, sent to their families. And it's a tool, Nestor, that is given to our law enforcement agencies so that they work within the legal authority to implement and to enforce a law.
Thank you, Nestor. Pacific Island Times, Johanna.
Half a day, everyone.
Half a day, Joanna.
Hello. So my question is for the governor. So I'm wondering if you or your team have made any other legal explorations as alternatives to extra powers you've requested from the legislature. For example, a former assistant AG Joe Guthrie said there is already an existing law, which is 16 GCA section 13102. Which states that it's unlawful for any person driving or operating a vehicle to willfully fail or refuse to comply with any lawful order or direction of any peace officer or any individual authorized under 13101.
Yes. I will use every legal authority I can to enforce the measures that I've put forward. So if that's available, I will use it.
So you're going to be like, so your team has already been looking into section 13102 and 131.
Our legal team, when we declare public health emergency and when we declare our measures, they are very comprehensive and they scrub the legal law to advise me of what my authority is, not just as a governor in the normal course of business, but also as governor in a public health emergency.
Thank you, Joanna. Next is PDN Steve Limpiaco.
Yes, hi, Governor.
Hi, Steve.
I want to follow up on something you mentioned last week. You said that you were, or GovGuam was securing a place for the island's homeless.
Yes.
You say, like, where is that and how will that work? And is that even necessary if there's not going to be a curfew?
Okay, so first of all, I think finding a place for the homeless to be able to contain them in an area so that we can have better opportunities to contain virus. As you know, the virus itself doesn't move, it moves with people. People are the ones that move the virus. So if we can better organize that and better control that, that's what we're doing. Excuse me. There's a team that has gone out through the community and they are looking at sites that would be able to give the resources and to give the services to our homeless. And of course, one of the requirements is that it's a place where they can have access to showers and the bathrooms and so forth. So there are 3 sites, Steve. We are identifying one that may be a real possibility, and that's over at the Paseo, where we could put tents up. There's showers and bathroom facilities there, and they will be giving me a report, but preliminary, that's what the site is that they're looking at.
And for my second question, I have a question for public health. So Director DeNorsi, can you comment on the public health policy that requires people to declare when they're bringing in PPEs, ventilators, similar items, and what's the purpose of that exactly?
Yeah, we had a guidance memo that was issued. It's the guidance memo is 2020-06, mandatory custom declaration regarding the importation of any of those items, and it's diagnostic tests, personal protective equipment, any medical devices, any serums, any vaccines and immunizations, or any ventilators and pharmaceutical agents. The purpose of that was just to, in the event that we needed to ration our supplies were critical in responding to the emergency, and also to prevent any importation of counterfeit items. Knowing that we do have supplies coming in from FEMA, we're looking so far so good with our PPEs and our supplies. And so right now, as long as the importer and the person that's going to claim these items is going to declare what is in their goods that they're expected to receive, they will sign a document that will provide that declaration. And as long as they sign it and they truthfully say what those items are and it's in truthful form, then they will get it. And the whole basis is to make certain that no counterfeiting is occurring and that everything is coming in safely and adequately declared.
Thank you, Steve. Mariana's Business Journal, Maureen.
Good afternoon, everybody. Buenas, Governor.
Buenas, Maureen.
Buenas.
So this morning, Hawaii residents woke up to the news that they were getting their personal economic stimulus checks by direct deposit. I know that our residents won't get the checks by direct deposit, but where are we in the timeline of getting that money to our people?
Right. So Maureen, the IRS can process filings and so forth real quickly. And so they also have the capability of doing direct deposits like you have said. We cannot do direct deposits because we don't have the information. But I think moving forward, Daphne is putting in another field to allow the option of giving in your information about your account and so forth. Where we're at is, as you know, we still have to have our implementation plan approved. Daphne has been on the telephone with her counterparts, and I haven't had any update from her, and it may have already been approved. But once that's approved, then the money will be issued to us, and then we can then print the checks out and mail them out. Because of that delay, what I decided is to advance our people some of that help and some of that assistance. And that's why I decided to look at all individuals who are making 10,000 or below, and we are going to start issuing the payments and the amounts that I had earlier described. So I'm hoping that that will happen before the end of this week. I'm informed that the process has been done, checks have been printed, and now it's going to be sent to DOA for distribution. That's roughly about 6,200 filers and 3,200 children. Those who are 17 years old and below will be getting a $500 check.
Okay, so for my follow-up question, leaving aside the quality of any tests among the Asian countries, a number of them were able to flatten the curve without shutting their businesses entirely. As we get closer to reopening commerce on Guam, will it be possible to do that while we still have positive cases, if we have flattened the curve?
So I know that the medical, my physician advisory group has 4 requirements to look at in order to start lifting those restrictions, and we certainly are going to abide by those 4 requirements. Once we meet those requirements, and we are confident that it's not prematurely done, I will start lifting the restrictions. I'm not going to lift them all at once, Maureen. I'm going to lift them based on how much more measures, based on what measures we should continue doing to again further strengthen the fight against the coronavirus. As you know, and as I mentioned yesterday, some of those countries, by the way, that have lifted are going back again and instituting their measures. Singapore is one. Japan, Hokkaido, which was the hotspot of Japan, that lifted their restrictions and had kids go to school and businesses open, are now reinstituting again their measures because they're seeing an increase in reinfection. As Dr. Cabrera said, it may be reinfection, it may be reactivation of the virus that was already infected in an individual. So, this isn't a black and white situation, Maureen. This is a, case by case circumstances. We always have to be flexible in adjusting our course with the end goal, of course, of protecting our people and preventing any more fatalities.
Thank you, Maureen. I-94, Adriana Cotero.
Hello. So my first question, recently on our radio show, we had Father Paul Gofigan about clearing the GMH morgue of unclaimed bodies. He said this was to make room because of COVID, and yesterday 2 more unclaimed bodies were moved out. There's been a lot of talk about building up our hospital bed capacities to 2,000 beds. And although I know this is a difficult discussion to have, but planning is important. And what we haven't heard on, and what I ask you now, Governor, is what are we doing in anticipation of the plausible worst case scenario of hundreds, if not thousands of deaths?
Yes, we've actually been planning. Like you said, it's been one of the most difficult discussions to make. We have been talking to public health. We've been talking to the AG. We've been talking to GMH. And so one of the plans that we are going to do in preparation is to provide refrigeration storage spaces at GMH. It's still very difficult for me to even explain, but these would be refrigerations that would house the fatalities. Our morgue capacity, I think it's only 9. And yes, we are cleaning it up, and we are trying to make more room and more space. But we have identified sites at GMH where we would then house refrigeration storage containers. The law does say that fatalities as a result of COVID-19 have to be disposed of, buried within 24 hours. So with that in mind, you know, I don't want to say this, but it would be like churning out and making room for space. It's a sad situation, and that's why, you know, I'm very adamant about the measures that I'm taking. And people may think it's very dictatorial or very aggressive, very hard, but we have to make those hard actions to avoid being in a situation where we now have to have refrigeration storage spaces to house our loved ones.
Your follow-up question, Adriana?
Yes, and as we know, with any crisis, preparedness is key. So with that being said, FEMA was expecting a shipment of additional supplies to Guam over the weekend. Can you provide any update in terms of what all is now on island, you know, with the federal medical stations? And also, we know the U.S. Army Corps of Engineers is working with FEMA and the Naval Facilities Engineering Command Marianas to assess 7 sites for these additional care facilities. So do you have an update on those assessments that are taking place, and where are these sites, and how soon will the facilities be up and running?
So I think you're talking about the alternative care facilities. And then you asked other medical supplies. So we are tracking medical supplies, and we are tracking more supplies to come. I think they are in Hawaii right now. And Chuck from our EOC said we're expecting it soon. These are your PPE. There are no ventilators. We did already receive 34 ventilators, which would make our inventory of ventilators to be about 71.
In fact, we have some of these portable ventilators that actually push up our ventilator count on island to over 100 at this point.
So, so that's with the medical supplies. We are going to, with that, I think we are going to have, you know, adequate PPEs, and of course, we're always monitoring it. We're trying to decrease the burn rate of these PPEs. We're also wanting to get a machine that would be able to re-sterilize N95s, and machine that can do 80,000 a day. So those are some of the resources that we are looking at, and we probably would be getting, and I know that they have been requested for procurement. As far as the sites, there are 7 sites, but just let me tell you this. What I would prefer to do is have medical tents around closer to the facility, closer to GMH, closer to GRMC, closer to Surgery Center. We've inventoried all our bed capacity for those areas, and I think just that with some of the plans for the medical tents is going to get us close to about 1,000 beds. Yeah.
So if you would like me to chime in a
Sure.
little bit more. And so this is very much a very well-organized plan that's done first from the state surgeon's cell, or in other words, the immediate task force that's working with Dr. Michael Cruz. And so that includes myself and for example, Dr. Lewis Cruz, who's a major in the guard. So he's actually leading the efforts in terms of organizing the alternative care sites and how that might roll out. So working closely, of course, with FEMA in that process. And so we're looking at a stepwise change. And yes, there are a lot of different factors. The first thing is to not have to build out beyond the walls of the hospital. We will try and maximize that use, but then we have these different stages, and that's why the projections and preparing for the worst case scenario is very important, so that we have these steps ready. For example, if GMH is getting closer to like an 80% capacity for COVID patients, then we trigger certain other steps, for example. So that's like an important part there. We already identified even close to 2,000 potential bed sites, and again, these are theoretical beds, and they're used in different levels of care, from high to medium to even comfort measures only type of bed situation. And that's the second thing I think was important for us to talk about, and it goes to your first question about mortuary repairs and of the like. And so we really are planning for plausible worst case scenarios. And if we God forbid have a surge where we have to see thousands of patients in the hospital in one day, we know very well that the mortality rates are gonna skyrocket from there. And we have to be more prepared for that and be extremely culturally sensitive to the needs of our patients and our community. And because of that, we're also developing plans that look specifically at pandemic home comfort care as well, because we believe that a lot of the patients may choose that as opposed to even coming to the hospital. We want to be sure that we're available to them, because care never ends for these patients, regardless of how far advanced the disease is, and we're always going to care for them. But there may be in a different manner and in different settings, and so we're planning for that as well as even what potential algorithms we may use or planning processes and decision-making processes for scarce resources like ventilators, for example. That becomes a common topic, but it's these very, very difficult questions we rather start talking about very early before it becomes more complicated and difficult to talk about later. So I just wanted to assure that these stages of planning are very, very much a part of every discussion we have every day.
Thank you, Adriana. Guam Daily Post, John O'Connor.
Hello, Governor. Can you hear me?
Yes.
Thank you, Governor. So I just want to go back to the CARES Act funding. We know that 117 million is part of 140 some million in funding per the release from Congressman Nicholas. In that same release, he urges for the payment of tax refunds, and certainly we've heard the same from some of our local lawmakers, especially those with concerns that tax refunds are being processed but not paid. So will you be paying out more tax refunds, perhaps as soon as the refunds have been processed?
Yes, we just recently issued about $1.8 million in tax refunds. So as the as the taxes are being processed and the refunds are being processed, we are paying them out.
Your follow-up question, John?
Yes, thank you. While a lot of the flights into Guam have been canceled, there are still a few of them coming in. So we want to know, can you confirm that other than having the 72-hour certification that they don't have COVID-19, are GovGuam employees or officials, can they be exempt from the quarantine requirements for travelers? And if so, how many have been exempted already? And what are those additional criteria for exemption?
There are no officials exempted. There are crew members that have been not mandatory quarantine. Those are worked out through the United Airlines and the carriers, and these are crew members that go right back in. So those crew members are self-quarantined. There are FEMA officials that, and actually most of them have already did have results and certification. There were a couple of students that came back and they were released to home because they did have those test results, but we follow the protocol and we do not endanger the safety of our people.
And there are also physicians that we also take into consideration.
Oh,
and
healthcare
military
workers,
personnel, too.
right.
Yes.
Thank you, John. And now for some closing remarks from our governor.
Yes. I am very happy to honor our National Public Safety Telecommunicators, our E91. This is National Public Safety Telecommunicators Week. E911 is extremely vital to our island's safety, security, and quality of life. 911 and emergency medical dispatchers, as you know, work long hours dealing with calls for help by real people in need. They are the starting point in obtaining essential information, all while remaining calm and calming callers. They give pre-arrival life-saving instruction to members of our community in need, helping our families, friends, and neighbors. During this pandemic, their skills are used to evaluate the signs and symptoms of COVID-19 before a patient even reaches the hospital. Their work dictates our response. This job is very stressful, it's demanding, and can be physically and emotionally draining. When we talk about the work of our frontliners, we often forget that many of them are not visible. Our dispatchers work behind the scenes, offering support to EMTs, firefighters, police officers, and anyone who comes face to face with COVID-19. To all the public safety dispatchers, thank you. Thank you for the work you are doing, and thank you for being a COVID hero. To do us,
Thank you, everybody. We'll see you again tomorrow.